This is News 25 with Deanna O'Donnell and Missy Kohler. News 25, local news you can count on. News is brought to you by J.K. Nelson Law. Call 727-9900 today for your free consultation. If you need a lawyer, you need Nelson.
Welcome to News 25 here on KPVM TV and Ace Country Radio. I'm Deanna O'Donnell.
I'm Missy Kohler. Good evening. Today is Monday, June 14th.
Well, fire crews are working a newly started brush fire that occurred around 11 a.m. this morning right over the top of the hill in Las Vegas. Clark County Fire and the U.S. Forestry Service, along with Bureau of Land Management crews, are on scene to a wildfire that was sparked this afternoon on Highway 160 in Las Vegas at approximately mile marker 15. According to U.S. Forest Service Ray Johnson, he told News 25 that this fire appears to be approximately 50 acres as of this morning. There are several engines, hand crews, and air tankers dropping fire retardant to get a hold of this wildfire, which is being exacerbated by the high winds and extreme temperatures. It's unclear how this fire started at this time.
And thanks to Eddie O'Brien for those videos. Last night, one person was airlifted to a Las Vegas trauma center after a vehicle versus pedestrian accident on Pahrump Valley Boulevard.
One male pedestrian was transported to a Las Vegas trauma center via Mercy Air after being struck by a vehicle last night on Pahrump Valley Boulevard, just south of Idaho Street. Nye County Sheriff's Office deputies, auxiliary units, and the Traffic Control Division of the Nye County Sheriff's Office were on scene. Nevada Highway Patrol was also dispatched to the scene to conduct the accident investigation. No one inside the vehicle claimed any injury at the time of the crash. The pedestrian's extent of injuries are unknown at this time. Much more local news after this break.
You're watching News 25, the most recognized and farthest reaching local news in Nye County. News 25, local news you can count on.
Welcome back. G7 leaders say they support a global corporate tax. The FDA will destroy millions of Janssen COVID vaccine doses, and McDonald's says no customer information was compromised in a hack attack. Angela Miles reports.
Topping our news, President Biden and foreign leaders of the G7 are endorsing a 15% global minimum corporate tax. The tax applies to locations where companies make money rather than where the companies are headquartered. The tax is targeting big tech companies, including Apple, and is a strategy intended to even the playing field among countries that purposely cut taxes to attract American companies. 60 million doses of J&J's COVID vaccine from the Emergent Biosolutions plant will be destroyed by the FDA. 10 million usable doses from that plant will be distributed in the U.S. and donated to other countries. The Baltimore plant remains closed following safety violations. McDonald's reveals no U.S. customers were compromised, but a hack attack in South Korea and Taiwan did break into U.S. restaurant information, including square footage of McDonald's.
A man in possession of an unusual dangerous weapon was recently arrested in a local bank parking lot.
Sheriff's deputies were called to Bank of America at 750 South Nevada Highway 160 in Pahrump for a report of a disturbance. It was reported that a male, later identified as Michael LaCroix, was throwing rocks in the bank parking lot. Deputies observed LaCroix sitting on the east side of the parking lot. According to the declaration of arrest, LaCroix was rambling his speech and was holding a trefoil throwing star in his hand next to his throat. LaCroix was allegedly yelling, "Bank of America won't give me my money," and saying that he wanted to die. Based on training, law enforcement knew that a trefoil throwing star is identified under Nevada law as a dangerous weapon. LaCroix was ordered to drop the weapon, and he complied. A second throwing star was located next to him within his grasp. LaCroix was handcuffed and taken into custody. Michael LaCroix was arrested for 2 counts of possession of a dangerous weapon. He was transported to the Nye County Detention Center and booked accordingly without incident.
Says that a Las Vegas hospital that required workers to complete necessary paperwork without pay after their daily shifts ended, also manipulating employee time cards to avoid paying overtime. The U.S. Department of Labor's Wage and Hour Division found Centennial Hills Hospital Medical Center, a subsidiary of Universal Health Services Incorporated, violated the Fair Labor Standards Act by failing to pay employees for all hours that they had worked. The employer also willfully manipulated workers' time cards in an attempt to avoid paying overtime by reducing the total number of hours recorded. Following the investigation, the division recovered $145,000 in back wages for 23 employees. The division also assessed Centennial Hills with over $19,000 in penalties for its willful violations and cited the employer for their failure to maintain accurate records of employees' hours worked. News 25 will return right after this break.
You're watching News 25, brought to you by Mountain West Lawyer, Injury Attorneys, 727-9500. News 25, local news you can count on.
Welcome back. Nevada Governor Steve Sisolak signed a bill into law that decriminalizes most major traffic offenses, classifying them instead of civil infractions. The reclassification means the jail time would be off the table for a large swath of traffic offenses, such as minor speeding, violating an HOV lane restriction, making an illegal turn, not wearing a seatbelt, or driving without a child safety seat. When traffic offenses are considered criminal misdemeanors, a court could issue a warrant if the person does not appear in court or fails to pay their fine on time.
Well, when it came to a consent agenda item on the last Board of County Commissioners meeting, the commissioners didn't just give them a stamp of approval. They were questioning regarding what it meant to accept grant money related to COVID vaccines.
Commissioner Cox wanted to be sure that accepting the grant money did not have strings attached that would require that all Nye County residents be vaccinated, and they do not say that. Nye County Grants Administrator Samantha Kramer explained the 3 agenda items that provide a total of over $10 million to the county to help with costs associated with administering the COVID-19 vaccine to adults and children, and a grant under the American Rescue Plan that will respond to the negative impacts caused by the pandemic.
So item number 14 is a grant agreement for us to administer the COVID vaccine to individuals that would like to receive the vaccine. This is just to assist with the cost in administering the vaccine that our DEM will be utilizing, so the payroll costs associated, equipment and supplies to offer this service to the public. Item number 15 is specific to immunizations for children. And again, it's for those that their parents or legal guardian would like for them to receive the vaccine. Same process, it's a payroll cost to assist DEM in administering the vaccine. And then item number 16 is the American Rescue Plan Act. Nye County was allocated a little over $9 million to administer this funding. We are still reviewing the interim final rule, which was given to us by the U.S. Treasury, and we'll continue to bring this item forward to discuss how this funding will be utilized based off of the federal guidance we receive.
Director of Emergency Management Chief Scott Lewis also gave clarification to what the grants will help with.
This is not a mandatory piece. This was simply capturing the cost associated with not only administering the vaccines, make sure nobody had to pay for it, but also the logistics supporting the vaccination pods, the traveling, the staffing models, all those things. But it is not geared towards a mandatory requirement for anyone to be vaccinated, especially to school-age children, because that's a parental piece to begin with. And they have every control over this point as to whether or not their kids are vaccinated.
When the chair called for the vote on accepting the 3 grants, the board approved 5-0.
The Nevada Department of Employment Training and Rehabilitation announces a change in debit card providers from Bank of America to the Way to Go card debit MasterCard. Throughout the month of June, unemployment insurance claimants will begin receiving their new green Way to Go card. It is vital for claimants to activate their new Way to Go card immediately, even if there's no funding yet on the card. Claimants can expect correspondence via email and mail and their online claimant portal with more information regarding the debit card transition. Benefit payments will not be deposited onto the new Way to Go card debit MasterCard until early July. Claimants should continue to use their current debit card as long as they normally would until then. Claimants should also continue filing their weekly claim as normal.
Well, the Las Vegas realtors are showing that local home prices are continuing to reach new heights while the local housing supply remains near historically low levels. The association reported that the median price of existing single-family homes sold in southern Nevada through its multiple listing service during May was $385,000. That tops the all-time record set in April. May's median home price is up 22.2% from $315,000 1 year ago.
News 25 WeatherCam is brought to you by Lerner and Rowe Injury Attorney's Office in Pahrump. In a wreck, need a check? Call 702-877-1500.
Ooh, John Kohler staring out the KPVM weather window. It is bone dry. It's windy. It is so hot. It's dangerously hot. We'll tell you all about the weather when we return.
News 25 weather is brought to you by Dairy Council of Nevada. The splash of cream in your coffee, the dollop of sour cream on your burrito, the melted toasty cheese on your pizza. Undeniably delicious, undeniably dairy. Enjoy what's real.
Hi, good evening, Nevada. It's John Kohler from the KPVM Channel 25 Weather Studios. Delightful to see you on a sweltering hot Monday. Let's take a look at the temperatures all up and down the state. I think you want to be in the northern part of Nevada today. Tell you what, Fernley, Fallon, Carson City, you're all up in the low 90s. Ooh, Carson City, pleasantly cool at 83 degrees. Tonopah, you're looking at 92. Goldfield, 93. As we head south, hot, hot, hot. Triple digits all the way on down. Beatty, Amargosa, Las Vegas, ranging between 101 and 111 degrees. Out to California, it's 118 in Death Valley. But here in the paradise of Pahrump, wow, look at this. Bing, 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 bing. It's been worse. It's only 105 degrees. I'm putting a happy face on it. It was 106 earlier. Bone dry, actually, 7% humidity as the winds are blowing out of the south, 15 miles per hour, putting kind of a bisque on the air. 5:25 a.m. in the morning, the sun rose, and it'll set this evening at 8:02. We're going to have some cloud cover moving in. That'll feel all right. Temperatures dipping down to about 78 degrees tonight. Those winds continuing out of the southeast to 12 miles per hour. Tomorrow, better? Nope. Oh, it's 190. It's 110 all week long. Let's just say that. Clouds are going to be moving in the next 3-4 days. This weekend clearing out. So we'll have clear skies, winds kicking up to about 15 miles per hour as we approach the weekend. But other than that, just kind of dangerously hot weather. If you can avoid being outside, definitely do that. If you can stay near some AC, lots of water. Take care of yourselves, folks. All right, it's dangerous out there. Back to the desk. It's Missy, Indiana.
Thanks, John. Hospitals across the country have reported a rise in lung transplants for patients with severe cases of COVID-19, and that's created new challenges for doctors along the way.
COVID-19 has really struck the transplant community in a very unique way, from the donor side of things to the recipient side of things. So we've had to think about the donors that we're taking to transplant. And for a while there, we thought donor activity would actually become an issue, and that we wouldn't have enough donors.
Dr. Marie Boudev is the director of the lung transplant program for Cleveland Clinic. She says COVID-19 can cause permanent lung damage due to the inflammatory response from the virus. Patients with that kind of damage are often on a ventilator or oxygen and are unable to recover on their own. She says rigorous testing is done before a transplant. They not only want to make sure the organ is healthy, but that there are no signs of COVID-19 infection. She says their other big concern is making sure the recipient does not contract any illnesses after they've recovered. That's why she continues to emphasize the importance of wearing a mask, social distancing, hand washing, and getting vaccinated.
If people would just get vaccinated, you might not be saving somebody else's life. You could save your life. And in many cases, you could save somebody else's life that you don't even know you ended up saving because you would not be infected or an asymptomatic carrier. I just urge people, listen to the facts, listen to science, take the vaccine.
Dr. Boudev says it's also important to think about becoming a donor if you aren't already. According to the United Network for Organ Sharing, there are more than 107,000 people who need a life-saving organ transplant in the U.S.
Thanks so much. Well, I got to tell you that the graduation DVDs are being done right now. I heard from our editor, Zach Reinhardt, that he is finishing them up. So if you are waiting for your Pahrump Valley High School graduation DVD, give us a call, 727-9400, extension 0, and we are going to be having those in the next coming days, and as well on digital copy. We all have your name and numbers, though, so we'll be calling you, but you're going to be getting them this week, so I'm excited.
That's exciting.
And if you haven't ordered one, order one. Same number, 727-9400. Well, that's going to wrap up this edition of News 25. I'm Deanna O'Donnell.
I'm Missy Kohler. Thanks for watching. Have a good evening.
Good night.